So till now we got to know that cluster headache is very severe type of headache and associated with features which seem difficult to control, but let me tell you that its treatment is simple and easy and it responds very well to treatment. The very first treatment which we offer to the patient is abortive, which is just to get rid of acute episode of pain. First line of treatment is oxygen. What? Oxygen? Yes, you heard me right. We give the patient oxygen with non-rebreather mask 12 to 15 liters in a minute for 15 minutes. The second option is triptans, which are 5-hydroxytryptamine agonists. It includes sumatriptan, which can be given as 6 mg subcutaneous injection, which has a rapid onset of action, or intranasally 20 mg per spray. Another drug of this category is zolmitriptan, which is given at a dose of 5 to 10 mg as a nasal spray. Then another option is dihydroergotamines, which are given 0.5 to 1 mg intramuscularly or intravenously. Now the question arises that it is such a dreadful headache and it comes in clusters, so can we prevent it? The answer is yes, we can. The second part of treatment is prophylactic, the purpose of which is to prevent horrible, agonizing attacks of headache. All the preventive medication are oral, and these are lithium carbonate, which is given at a dose of 300 mg per day and can be increased to 900 to 1200 mg in divided doses. The second one is verapamil, which is a calcium channel blocker and given at a dose of 240 mg per day and can be increased to 960 mg per day. The third one is topiramate, which is basically an anti-epileptic drug and it is given at a dose of 100 to 400 mg per day. One important point here is that the medication which I just mentioned, especially topiramate and lithium, take weeks or so to be fully effective. So what to do during that time? So during this duration, we do something called effective transitional therapy. It not only terminates the cluster headache cycle, but also prevents immediate recurrence. And can you guess which medication is this? Yes, these are steroids and they are effective in 70 to 80% of cases. So we give prednisolone at a dose of 60 mg per day for 5 days and then withdraw it over 7 to 10 days. Here I want to emphasize on one point that steroids are used only as transitional therapy and not for aborting the acute attacks. And of course, along the medication, we should instruct the patient to keep a headache diary to monitor the effect of therapy and also to keep an eye on triggering factors and then to avoid them, and maintaining a healthy lifestyle is always helpful.